Hi, it's Dr. Centeno, and this is how do I read my DMX report? Now, this is a question I get all the time. So to read a neck DMX report, which is the most common one, please realize that DMX is a movement-based image. So we're looking for too much movement between certain parts. And let's focus on three different measurements: translation, inflection, and extension, Atlantodental interspace, or ADI, and C1, C2 overhang. So while there may be other things on the report, many of those things are associated with normal wear and tear of aging and are probably not necessarily causing you pain. Now for translation, this is when a vertebra moves too much and sliding between flexion and extension. So if it moves forward, it's called anterolesthesis in flexion. When you look up, if it moves backwards, that's called a retrolesthesis in extension. Now, the normal allowance is there for C2-3, only about 1 millimeter. Not much movement is allowed at C2-3. Abnormal for the lower levels is more like 3.5 millimeters or more. Now, another thing you should look at is the ADI, or Atlantodental interspace. As you can see here, that's when the C1 atlas moves forward of the C2 and creates a gap right there. An abnormal is going to be 2.5 millimeters or more in young people, and as little as more than 1 millimeter in older people. And that's because as we age, this normal distance gets smaller and smaller. So here are the normals by age group, so you can determine whether or not your ADI, as it's reported on the report, is normal or abnormal. Then finally, C1, C2 overhang. And this is in that open mouth lateral bending view where you're doing this and you're opening your mouth. And we're measuring the corners between C1 and C2 as shown here. Now, when the dens is not symmetrical in the middle, meaning the C2 dens is not symmetrical in the middle between the C1, then 3 millimeters is about a 2/3 chance of that being abnormal. 4 millimeters is a 95% chance of that being abnormal. And that would indicate, just like for the ADI, craniocervical instability, or CCI. So in summary, focus on those three findings because in my experience, those are the three that are most likely to be abnormal and cause problems. You can easily read your own DMX, and obviously please review your findings with the doctor that ordered this study. Thanks so much for watching and have a great day.